So I'm a retired doctor now. I don't work as a doctor anymore. I did work for 20 years in family practice. 7 years I was coordinator of the palliative care unit looking after terminally ill people in Vancouver Hospital, and for 12 years I worked in Vancouver's downtown east side looking after people with severe addictions to cocaine, to crystal meth, to opiates like heroin, to alcohol, of course. People dying of HIV, of hepatitis C, and every other disease caused by addictions. And in my practice, I looked after young families, I looked after people of all ages, and I'll tell you what I've learned. The one thing I've learned many things, but the one thing that I can reduce it to or simplify it to is that virtually everything I ever saw, whether it was cancer, whether it was multiple sclerosis, whether it was depression, whether it was addiction, whether it was ADHD, whether it was colitis, rheumatoid arthritis, you know what it came down to? It came down to what happens in people's childhoods. In other words, the major contributor, I don't say the only, but the major contributing factor to the onset of illness, whether it's mental illness, physical illness, whether it's addiction, whether it's behavior problems, what happens to people in the first few years of life. And that may seem like an astonishing statement, and how is this guy going to prove it in the 16 minutes that he's got left? Well, let's give it a try. In the downtown east side, which is Vancouver's drug area, and not only is it Vancouver's drug area, it's also known as North America's most concentrated area of drug use. We have more people there using injecting substances than any other place in North America in a few square block radius. I can tell you that over a 12-year period, I didn't meet a single female patient who had not been sexually abused as a child, not a single male patient who had not been either physically abused or sexually abused or neglected or abandoned in significant ways. And in North America, we like to think of addiction as either a choice that people make, and if they make that choice, then we punish them for it, so we build jails where we keep people who use drugs. Or we see it as a brain disease that's genetically inherited. So if we look at the sad fact that in Canada, 30% of the people in our jails are First Nations origin, where they only make up 4 to 5% of the population. We explain that by saying that these poor people genetically are susceptible to addiction. So it's either we make it into a disease or we make it into a choice. Neither is true. It's not a choice. Nobody ever chooses to be an addict, nor is it something that's inherited. We know, for example, that even people that do inherit some genes that are predisposed to addictions, if they're brought up in proper environments, they have no more risk of addiction than anybody else. So it's not ever the genes that cause the addictions, and nobody ever chooses the addiction. What actually happens is when people are traumatized, that increases their risk of addiction. And if you want to know why the First Nations population in this country, it's because they're the most traumatized segment of the Canadian population. Historically, I don't suppose I have to tell you about that, but the fact that in the prairie provinces, I'm not sure what the percentage are in Alberta, but I know in Saskatchewan and Manitoba, I know the percentage is high. I don't know how high it is in Alberta, but most of the kids in care are First Nations origin. This is in a population that knew how to look after their kids beautifully, that if you look at the parenting practices of First Nations people across the world, they're actually superior to those of industrial societies according to all the research, unless they're traumatized, in which case the trauma is passed on from one generation to the next. So when it comes to addiction then, what we're looking at is the impact of childhood trauma. Why? Because number one, let's just define an addiction. An addiction is any behavior, substance related or not, that an individual pursues because they find pleasure, relief, or they crave it temporarily, so they pursue it for the pleasure and the relief despite negative consequences, and they don't